Thank you for coming and welcome you all. You don't need me to tell you how busy social care is at the moment and that there's a great deal happening. The 11th, which was Monday, was a significant date for several reasons. One, it was supposedly the delayed start of the CQC portal. That has been delayed again because it clearly didn't work. If you try and you find you can't get in, I think the message is to keep trying. And I'm sure that CQC will be in touch generally as they get over the problems. Some people are being able to access it without too much hassle, but I'm aware that others aren't. Maybe it's regional, maybe it isn't, but keep us in the loop. One thing that we've asked people to let us have, the national body, the Care Association Alliance, is coordinating information around fees and fee increases across social care. So if you could let me know which boroughs you work in or which county councils fund you, how much they're paying per hour or per night or per week, whatever, and what increases for the next financial year. We will put that together and it goes into the national survey. It's all anonymous, and we know the rates vary, and we know that some local authorities have put up fee rates by 0%, and some by 8% or more. So please let us know. It's a useful exercise. Okay, I'll just hand over to Dudley for a few moments, and then we'll kick off into some slides.
Thank you for everyone for coming today. It's interesting, as Peter said, this week has been one of those weeks where so much has come back and forth for those for social care, and I feel sorry for managers and providers at the same time, because there's so much to digest, yet you still have to do your day job, unfortunately, which is a sad side of things. So my hat and my heart goes out to you all and doing what you're doing. Well, think about me and Peter also trying to get as much information together and make sense of it as well. So there's a lot flying on our desk, what we're trying to work with, yet alone outside influences and agencies. We know things such as international recruitment. We know a lot has been changing in regards to that. So elements around people just getting their licenses, but also revocation of licenses, but also as well, we know that dependents can't come in now as well. So what effect will it have on the sector as well is also important. As Peter said, the new SMS portal from CQC is you can actually now access it as well. And Peter said, as people have been finding some troubles, they've sent new links, so please do go on there as well. And the importance of the reason why that portal is so important, because when you're making notifications going forward, you're going to have to use that portal instead of actually doing it the way you were doing it before. So it's hugely important. I will share a link potentially in the chat to actually go on their website of CQC. Hopefully that will be able to allow us to be able, or allow you to be able to try and get forward and know what you're doing, but also do find and look at any information that you see. We will share what we can, but if anything, just contact CQC if you are still having troubles beyond that. I would say, Peter, outside of that, I would say just keep your ears and eyes to the ground of all that's going on, because there is a lot going on over this next, and as we know, it's a rundown to Easter. It seems to be getting busy. Remember, it's the end of the financial year, so a lot of local authorities are going to be changing up matters as well, and also pay attention, of course, of things such as increases for the minimum wage as well. Prepare yourself for that, because it's going to really affect you financially as organizations, and some people haven't thought about it, but it affects everyone all around. And so your margin costs, we understand your businesses, so we understand your margin costs, how it works. So speak to your accountants, also with your staff as well. It's hugely important.
What I can say is that when we talk to CQC, they will tell us that a successful care business is, if you like, 50-50. It's 50% focused on business, 50% on care. To reiterate, we are looking for fee rates you're receiving and also the any updates. So please email me, text me, send them on to Dudley, whatever, just so that we actually can get them, please. Now, if I can make these slide. Now, what the slide in front of you is actually showing is weighted average hourly prices for home care in 2023, and you'll see that the average price, Greater London is the lowest area in the country, and it's probably the area with the highest costs. And the reasoning behind that is because, and commissioners will tell us this, if they're offering packages out at £19 an hour, there is always a dom care provider prepared to do it for less money, for £17 an hour. It's a race to the bottom. And we get a reverse concern from CQC, local authority quality monitors, that quality is going down, and they are very concerned. And this knocks on to staff. It knocks on to the quality of how staff are looked after. And as individuals, there's little you can do about it, but it's worth taking note. And at a higher level, we are trying to do something about this. There are representations to get fee rates up. Okay, travel time for DCA staff. Now, I'm not going to dwell on this, but I will tell you, because we've been told that social care providers are a target area for HMRC inspections. And we, Dudley, myself, colleagues, we are contacted time and again by providers who are not getting travel time right. And I know that times are hard. We're well aware of the low fees, etc., but HMRC have absolutely no sympathy at all. And I know one or two legal practices have looked at whether the local authority can be called in as guilty. Nothing has been done about that as yet. But I've put on there a link to a webinar that the HMRC ran, and you can find it on that page. If you can't find it, let me know. It's worth a look. It gives you some very clear information, and please do follow the rules. I'd also, from continual professional development and from the point of view of getting your inspections right, sign up to the likes of LCAS and HMRC and get their updates, use them as part of your CPD and evidence that you are doing this, you're taking action. And if you are contracted to pay the London living wage, it should actually be paid. We know that some providers are saying they are given fees to pay the London living wage, but they're not actually passing it on. Local authorities are now starting to check this quite rigorously, and they can do it from pay slips, etc. And look at what your contract says, because most of them are actually entitled to have that information. And we all know that the London living wage, which is now £13.15 an hour, is being rolled out by the likes of Marks and Spencers and Tesco. And this is competition for your staff. So it is difficult. If you can only afford to pay them £11, you're probably going to lose staff. And we'll come back to staffing later in today's event in several ways. You're all businesses. Even if you're not for profits, you will have a social care enterprise or a limited by guarantee company or a charity. As of earlier this month, Companies House updated how they're doing, how they're regulating companies. The reason they're doing it is to get over the increase in fraud. Many companies have been set up and they haven't been used, they've been dormant, or they've been set up, they've run for a while, and then they've closed down without paying any tax, and leaving staff, customers, etc. in the lurch. So there's a whole list of stuff going on, and they're querying information, and it's about fraud. And so they're looking for registered email addresses, and people are going to have to confirm why they are opening a company, and they are finally getting better at sharing data between government departments. And that hasn't happened, as many of you who've been involved in international recruitment will know, but it's come as a bit of a jolt to them. Just a quick slide about the London living wage. Excuse me, this is becoming more and more into the fore. We are seeing the Mayor's office in London having a big impetus, big press, big project to get the living wage. And by the end of 25, if not before, all the NHS units in London will be paying at least the London living wage. So that will be more pressure on your staff to move on. We meet with the Living Wage Trust. We meet with the NHS people behind their work with the living wage. And there's a lot of work going on in the background to see what can be done to support social care staff to get the fee rates up. The NHS people that we talk to they don't want to steal social care staff because they understand how important social care is. If social care falls over, the NHS falls over very, very quickly. But if you are paying at least 13.15 an hour, then have a look at accrediting your company to the Living Wage Foundation, because it's useful from a marketing and also from a recruitment point of view. Again, LCAS, I would urge you all to use the LCAS website. It's free. Their phone line is free. They're very good. They have a number of free webinars, such as you can see on the screen in front of you. Most of them are short. They're very well done. They come with notes. And if you look at the way employment law is going, even things like flexible working, you need to be on the case. And it's just a really useful free opportunity, to support your management and be able to support the well-being of your staff. And as I say, most of them are less than an hour. They're designed for SMEs and they're really very useful. Okay, and 15th of March is World Sleep Day. We could probably all do with an extra couple of good nights sleep. So do have a look at that. And if you've got any queries that we can help you with, there's our contacts. And I'm sure many of you know them already, but we'll put them in the chat. And you're very welcome to talk to us. And I think that's all on that sequence. Yes, it is. So I will get rid of that lot. Okay. Just let me do that, admins. Okay, any points coming out of that or anything that Dudley wants to raise after that? I can see
how we can beat the sort of sleep day. I think that's probably some of the slides that you shouldn't have started on. No, I think it's hugely important. I mean, it would be good if anyone wants to ask any questions in regards to some of the slides that were there. There's some important things that were there. So before we go on to the next speaker, does anyone want to, you can put something in the chat. I think Peter's going to share probably some of the links in the chat if you can during the talk, because I think there's some really good stuff there. I think it's hugely important that people don't get the time. And as great as Peter is, or I am, in trying to share as much information as possible, it's always good to have that direct as well. Link yourself is hugely important in regards to that. I would say moving forward, it's to bear in mind, it's as businesses, it's for yourself to actually keep up with things. If you miss it and you miss deadlines, you're going to be in trouble. Yes, it's always good to have, and if you can't, for example, keep up, then I would advise then having access to, for example, an accountant, a good HR individual, or signing up to a body that's going to give you regular updates. We will do as best as we can, but the more official that you have, then the better it is for yourself as well. And Peter will keep going on about it, and so will I. You are businesses, and so you are also relying on actually, you know, complying to all the laws of business, not just for care or social care, but for example, financial, HMRC, and if you're doing international recruitment, following that with the Home Office, all these things really are down to you. Go ahead, Peter.
Thanks, Dudley. And just sort of harping on about travel time, asking Dudley or I the same question 10 different times isn't going to change the answer. If it was wrong on the first occasion, it's still going to be wrong. And Skills for Care can't be with us today, but I have Ali's slides, which I will run through. There are quite a few of them, so I've picked them over. I will go through some of them in more detail. All the slides with all the links will be on the website very shortly, as will be the recording of the meeting, which Dudley will process. Just before we move on to Skills for Care, as you'd expect, quite a lot of the Skills for Care work is focused on CQC, and it's focused on the single assessment framework. Now, two things come back to us time and again from talking with CQC at high level or talking with inspectors. And these come through again from Skills for Care. One is communication, and that is communication between the parts of your organization, the owners, the managers, and the staff, and also the clients or the service users, and communication with the other stakeholders. So local authorities, regulators, etc., and evidencing what you've done. So if you like recording meetings or taking notes, these are all important things to do. Particularly communication. Skills for Care, when they regulate, inspect, monitor your business, they will be looking to talk to your staff, which they will do remotely. So your staff need to be singing from the same hymn sheet. And if your staff have got a grudge, then that's going to come out. And they will also ask your staff how they've been trained on whatever it is, policies, for example, and how those link to the working of the business. And they need to be able to come up with a cogent answer. And just having bought a raft of policies, printed one of each off and stuck them on the shelf is not good enough. Basically, you need to take the key policies to put together if you like, an A4 bullet point sheet for each of those, and to make sure that the staff fully understand them and can answer questions about them. It's really important when they're working, they're caring, they're responsible for people who are vulnerable. And just harping back to CQC, and again going back to a degree to international recruitment, you'll all be familiar with tales of nail bars, etc., exploiting staff. The top area in the UK now for staff exploitation is social care. Now, I'm not quite sure how that's measured. but we are assured that that is correct. And again, CQC are not responsible for international recruitment. There's not that much they can do about it. It's the Home Office. But CQC can and do look very closely at modern day slavery and exploitation of staff. They have a department linked to safeguarding that manages that, and they're actually pretty good at it. It's run by a lady called Claire Brown that has been to a number of meetings for us, and there are slide sets showing that on the website. They're on the international recruitment page a couple of times. If you can't find them and you're interested, do let me know. Okay. What I'll do is I'll run through the Skills for Care slides. If you've got direct questions about Skills for Care and you don't have a Skills for Care contact, let me know. We will pass them on. And all I need to know is what the question is, obviously, your contact details and the area of London or outside of London that you work in, and we make sure that the right Skills for Care person gets a hold of the information and gets back to you. Okie dokie, let me just... Okay, so let me flick on from this. They've got a series of seminars and resources. Now, their website is very big. There's a huge amount of information on there, but some of these things are very, very good, and many of them are free. Some of them aren't, but have a look at them. If you can't find things on the website, try Google, but also contact your local Skills for Care person, and they will find it for you and point you to it. As you can see, they're doing a lot of work on CQC with the single assessment framework. Again, their website has a lot of stuff on there, but they are also running seminars. So you'll get this information, but if you can't find it, again, let us know, find it on their website, and do look to see what is there. There is a rumor going around that with the new single assessment frameworks that Skills for Care are doing, they're downgrading people. Now, I was at Skills for Care, I don't know, a week, 10 days ago, and so far they've done, they were able to give us the information on 51 inspections carried out under the new process, and none of them had actually been marked down. So most people had stayed where they were, good or RI, and so it's one of those miserable rumors. So don't take a lot of notice, but do make sure that you are prepared for your inspection. You've got your PIR in, etc., etc., and stuff like this is really helpful. Inspection toolkits. So this supports you through the transition to the new single assessment framework. Two different versions, one for the old, one for the new. But again, it's useful stuff and it's free. I know you've got to find the time, but then you're going to have to find the time anyway. So, find that time and use it usefully. And if you're struggling with some of the basic stuff around, say, employment contracts, think about using an operation like Citation who can help you with a lot of that stuff and your health and safety, and they'll take those issues off your hands. CQC are doing quite a lot of, Skills for Care are doing quite a lot of products now, which are paid for, but they are good value and they are well done and they're very relevant. Good, people are still joining the meeting. There's a whole pile of links on there which will take you to workshops, seminars, etc., etc. And some of these things, they will, like with the training, they will ask you to sign up to ASCWDS, which is useful for the overall statistics for social care. If you're struggling with something, there are some contact details on there that we can contact Skills for Care directly, but again, come back to us. There are funded essential training programs. Now, some of these, I would guess that some of you will be on there. The training must be completed by the end of March. So, you know, if you haven't signed up already, basically forget it. Leadership programs, funded leadership programs. There's some really useful stuff here. And leadership is frequently mentioned as a key name of the game item. And again, we see from CQC inspections and also from local authority monitoring visits that leadership is lacking and that managers need to be upskilled in various areas. And you notice the words effectively supporting the workforce. You'll hear later on today from PJs about pastoral care for international recruits, but it's also vital that the physical well-being and the mental health of your existing staff is taken into account. And that is something that CQC will be checking up on in their inspection. Again, yet more information on the single assessment framework. And you can go through the toolkit, and you can sign up for their seminars. And the other thing I would urge you to do is talk to your colleagues. If you know somebody who's actually had an inspection, ask them. Find out what went right and what went wrong. Moving up, Dudley is co-chair of one of the Skills for Care EDI committees. They're working hard in this area, and the moving up bookings are now open, but I would point out to you, you need to register by Friday the 15th of March. And I would also say to you, if you spot any spelling mistakes in these slides, I didn't put them together. They're not mine. But please, moving on bookings, please get in there and get involved in that. It's a very useful program, and I'm sure that Dudley can give you more information, you know, later in the day about that. This nursing in social care, I'm sure there are people here who know far more about this than I do. It's always been a bit of a grey area. Nurses in general are in demand. Some NHS nurses don't think very much of social care nurses. However, a qualified nurse is a qualified nurse. There's a high demand for nurses across the board. And if you can help support this type of initiative, and you'll also find initiatives with social workers. Now, social workers don't quite rule the world, although they often think they do. But working with them and showing them how social care works is very valuable. And we've had some great information and co-working with social workers who are working really hard to do a good job, get placements, and also organize reassessments and stuff like that. And when you talk to them, they need to understand how your organization works, what your restrictions are, because many of them don't know how much their own local authority pays. So they don't understand how the system works. So take a little time and explain it to them. Skills for Care, as you know, they do their own registered managers webinars. They also do them for deputy managers. And a lot of it is well delivered. It's good quality stuff. So if you've got the time and the interest, do sign up for these. They've got a whole range of blogs. and they vary. People like them, and you can take them with you, and you can learn from them at times that suit you. I'm not sure how many of you are actually members of the Registered Manager group. It's relatively cheap to join, and you can offset that against your tax. It comes with some freebies, some information. The monthly newsletters are always useful, and there's also a couple of free books that come out with it. And again, it's useful stuff. It gets you invited to meetings, and you can learn from your colleagues. Peer-to-peer information is always good. And coming back to CQC, when CQC ask you about your business continuity plan, as a small business, they will ask you what happens if the business folds or the business can no longer run. If you've worked a system with another small organization that will pick it up, you've ticked a box. And also on the subject of business continuity and emergency planning, if you've got international recruits, you need to include those in your BCP, because if you lose your license and you've got, say, 10 international recruits working for you, they will no longer be able to work for you. So how would you manage that? How would you cover that? And if you renew your membership, you get another free book, which again is useful. And for those of you who don't know about Care Friends, Neil Eastwood, who runs Care Friends, has recently revised his book about social care. That too is a useful source of information, particularly about recruitment. Care Guide, which is being put together by CQC and the Outstanding Society. Outstanding Society are very good. There may be people from the Outstanding Society here today. They also interact with CQC. And if you remember, you get the book for free. As I mentioned, Deputy Manager Networks, useful to get your staff signed up. The next one is the 14th, which is pretty close, but they're regularly held, so useful to look at. Back to international recruitment. We ran, as I'm sure most of you know, LCAS has been asked to run a series of international recruitment webinars, events, etc. We ran one on Monday in Croydon, which was very successful, and Skills for Care presented there a different set of slides. Those are also available on the website if you wish them, and they've got a lot of information, which is very helpful. Now, international recruitment is a great way to build your staff. It's not the only way, but it's a great way, but it needs to be done properly. It's not cheap, and it comes with a range of responsibilities, and they're all covered in this information. That's sort of a bit old hat now, the state of the social care report, but again, it's there if you want it. I'm sure that most of you will be aware that the Workforce Development Fund is changing. It has been run through Skills for Care. That may carry on, it may change. But there is also the launch of the Care Workforce Pathway and the introduction of the Care Certificate qualification. And there will be funding available for that. If you work with various social care training providers, they work the Care Certificate at the moment into a level 2. Having it as an actual accredited qualification is very useful. And you'll also see here a new digital leadership qualification. Now, if your organization is not digitally competent, you're probably not going to be in business over the next couple of years. You're going to have to be part of data transfer, and it's going to be the only way that you're going to get packages. Innovation is going to be one of the saviors of social care. And I can almost hear people groaning when they see the £20 million for apprenticeships. We know that in many cases, apprenticeships do not work well in social care, but there are moves to make those qualifications work for social care as opposed to making social care fit for apprenticeships. And having said that, there are some very good apprenticeship schemes which are working extremely well in social care. Back to the care workforce pathway. The first part focuses on direct care and support roles at 4 levels, which you can see here: new to care, care or support worker, supervisor or leader, and practice leader. Now, there's a great deal more to it than that, as you'd expect. And you can pick up the information from Skills for Care. And I think there will be specific meetings targeted on this, where you can learn the great detail. Now, you'll all be aware of Think Local, Act Personal. And again, it's another route to CPD updates. The values there, they're not new. It's just reiterating the whole thing and how care should be done. And this is all very easily said, and I know it's more difficult to do when you're working on no money. But hopefully that may change over the next few years. So the next steps with the care pathway, the DHSC and Skills for Care are working together on phase 2. So there's a link to pick up a lot of information. And if you have points to make them now. Talk to Skills for Care. Most of their staff are very open. Most of their staff have worked in workforce areas. Some of them have much greater expertise. Some of their staff have also worked for CQC. So there's a lot of a will to cooperate there. Okay, back to the care certificate accreditation. It's going to launch in a couple of months. There will be funding. My understanding is the funding will be limited, so get in first or miss out. That's Ali Porteous's email address, and there's a bottom line at Skills for Care as well. But if you if you've got any questions, fire away now, and we will try and answer them, or we will take them back to Skills for Care. Great. Okay. I've talked far too much. Any questions? Any points?
Well, one thing I would say, everyone, you can ask questions before we move on to the next topic. Do try and sign up with Skills for Care. Even if you do go on it, it's a huge website, I understand, but if you type in a topic directly onto the website, it may send you in the right direction. And one thing I always get from a lot of care providers, it's not that they don't know what they're doing, it's the fact they don't have the time. And actually Skills for Care provides a lot of templates, easy to read guides, which you can actually download and use as well. Even if it's for 5 minutes watching a video or actually catching up with something like that's been written as well. And if any of you are brave enough as well, they're very open to blogs or expert knowledge from individuals like yourself, actually showcasing what you're doing or what you're doing well, because then that's likely to be shared with others as well. So do bear that in mind. So other than that, Peter, I'm not sure if there are any other questions before we move on to the next area. Let's see. Oops. Can you see my slides at the moment, everyone? I'm on mute. Yeah, I thought as much. Can you hear me?
Yes.
Okay. I think Peter was on mute, sorry. So thank you, everyone. Today, you have the pleasure of me presenting today, not as an LCAS co-chair or chair for LCAS, as actually I'm presenting and showcasing what I get to do on other times of the day, of the week. It keeps me very busy. One of the areas that's really important at the moment, especially for the sector, is alongside with the reminder of the overseas workforce coming into play, but also those staff here in the sector is really important, is around the element or the area of equity, diversity, inclusion, health and social care. And I'm going to just showcase you, hopefully in the next 20 minutes, just of why the importance of it and why it's here. So it's hugely important, first and foremost, by starting here, and this is my first protocol, is how names are pronounced. And I think that's the first thing that I always find very interesting, because apart from meeting someone face to face, getting their name or hearing a name is the next thing that you hear. And here is that called My Name Is. It breaks down the spelling of your name and phonetically, so you're able not to get something wrong and able to showcase why it's important when having a name and pronouncing right is hugely important. As you can see on the side, I've also added in my pronouns so that anyone's confused or not sure. It also showcases to you actually my pronouns, which are he or him. And then you can put that on your signature and cover various things like that. And other than that, apart from obviously working as a consultant, working for LCAS, I've worked in various projects with SLAM and NHS around the well-being of staff, supporting international workforce, also for Champion of Diversity Inclusion for Change as well. And I speak a lot on it, not just locally, but nationally as well. And you'll see me banging and harping on about it and the importance of it as well, which is huge. I'm also the co-chair for the Race Equity Reference Group for Skills for Care. So nationally, I'm considering why it's important for staff and when we're talking in this area and space. So I started off with saying why a name is so important. Well, 73% of people have had their names mispronounced, regardless of the reason. It's hurtful for those affected. After all, your name is more than just a name. It's part of your heritage, identity, and pride. And hopefully I'll be able to play a video. I'm not sure if it'll work. Let me know if you're able to hear it, of why a name is so hugely important.
Oh.
Well, I've been called a lot of things in my time.
Zanba, Shabiba. Somebody once just went at me.
They say Sumek, Sumac, Sumok. I mean,
I remember just growing up thinking, yeah, I wish I had, a different name.
no, I don't think a name is just a name. It reminds me of my parents,
My culture, my heritage.
my story. And then when we change that, we take away that beautiful part of ourselves.
When somebody pronounces my name correctly, I feel really seen, an ultimate sign of respect.
And the cost of giving it up is too great. So, yeah, I'll continue to fight for it.
My name is Zainab Al-Farabi.
My name's Shomik Data. My name is Ine Victor Olawumi Garrick.
As you can see, the importance of why actually having your name pronounced correctly is hugely, it means more to some, the others, but actually even pronouncing, and what I'm finding is that we have a lot of overseas workforce coming in and we are such a diverse sector, but also what you're finding is that people pronouncing English names isn't always easy. A woman that I've worked with, her name is spelled Joan, and most people call her Joan, but her name is actually Joanne. So actually understanding how to pronounce that is very interesting. You'll be surprised that my name is Dudley, but people pronounce my name Dudley. So it's important when it comes to names, how it means, the importance it is for everyone. And getting someone's name wrong is probably the beginning of maybe not the best start, especially for staff coming into your workplace as well. So as you can see here, EDI is at the core of great people management. It's an organizational issue that is becoming ever more important and increasingly complex as we encounter conflict and different views. In health and social care, inclusion and equality have long been part of the protected characteristics for people we care for. But are we supporting health and social care staff, which provides one of the largest diverse workforces in the UK? Remember, everyone, there is no I in team, and a more inclusive workforce means a better representation, but also benefits the sector with retention and recruitment. UK health and social care providers have a legal obligation to address inclusion, discrimination, equality in policies and services. So it's not just on the mere fact of a nice to have, as you've seen around there. It's important and actually in retention. Show you and explain to you why it's so important. So for anyone in leaving here, I want you to understand that diversity is the mix of people around us. So you can see around this room and in this chat room today, there's various different cultures, different sizes, people of different religions. It's hugely important. And as we know, equality is a choice. It's for your choice in which to support someone, come here. That's hugely important. But inclusion is the overarching culture that encompasses diversity and equality and many other aspects of our working lives. It's also the culture in which the mix of people can come to work, feel comfortable and confident to be themselves, and deliver your business needs. Remember, inclusion will ensure that everyone feels valued and importantly adds value. And that's one of the things that I'm finding with a lot of staff is if they don't feel valued, they can't add value. And the likelihood they won't stay. Diversity inclusion is not just about what is said and done, but also about what isn't done or disregarded. So actually, if we think about now, at the moment, we know that Ramadan has started, and we know there's a lot of Islamic work. There's a huge high percentage of Islamic workforce in working across health and social care. But then if you're not actually taking or putting into respect their culture and their religion, actually giving them maybe time to pray, or if they're working, for example, a time when they're going to break their fast, are we doing that? Not doing that is going to affect how people are. So do bear that in mind when we're doing this and looking at this area, which is highly important as well. So I just pulled together some words, some positive words that we look at when we think about EDI. And you can look here, all of these things are what things that we like to see, not just for staff working in the workforce, families coming to join the survey, to bring families or their loved ones to your service as well. So you think about openness, honesty, welcoming, inclusion, affirming, courage, support. Are we doing these? Accountability. These are just all the words which represent EDI. And are you doing that in your working environment? Really question yourself. But if staff see this and they're applying for a job and they saw this here, they'll say, do you know what? If these are the values of the workplace that I'm going to, there's a good chance I'm going to come here. But also as well, it's a reminder of you from actually completing and continuing to also have these values within your organization as well. If you leave here, really question whether it's something that's actually taking place within your organizations. But for every good, there's the other side. There's lots of different characteristics, as I know, as we've said in this sector, and as individuals, we're all set apart from each other, from someone's ethnicity, their religion, their gender and sexuality, age, or even if they have a disability. All these characteristics could lead also as well to varying levels of discrimination as well as people's privileges. So for all the good with all those lovely words, there's a growing area and space around the element of actually discrimination. And are we discriminating? And I'll tell you why this is hugely important when we think about it. CQC looked around the areas of actually thinking about how culture appropriate are we with our care. And culture appropriate care, or as I classed it, culture-centered care, is sensitive to people's cultural identity or heritage. It means being alert and responsive to people's beliefs or conventions that might be determined by cultural heritage. Just so that you all know, cultural identity or heritage can cover a range of things. For example, it might be based on your ethnicity, nationality, or religion. It also might do with the person's sexuality or gender identity. So whether you identify as lesbian, gay, bisexual, transgender, people have a particular culture. Even deaf people who use British Sign Language also do that. And why is this important, you may think and may ask? If you think about the regulations, culture appropriate care, it's relevant to the areas around the Health and Social Care Act 2008. And if we think about it, regulations 9, person-centered care, which I'm sure you all abide to. Regulation 10, dignity and respect. are we respecting and do we have dignity for not just our service users, our staff? In Regulation 11, the need for consent, it's hugely important. So don't get it wrong and think, oh, this is just a nice to have. Actually, CQC are saying, are we demonstrating this? And actually putting that into your care plans and records is hugely important. I always find this, that people always think culture means just ethnicity. It might just think about nationality. Actually, if you see this person in the middle, culture can apply to any of these areas. So we talk about ethnicity, disability, we think about economic status. We know if someone's poor or probably someone who's rich, people are treated differently. So are we really applying that? With education, we look sometimes down on people who may not be as educated to those who are. So are we giving them the full respect? Age, are we ageist? Are we giving people the chance to work in our organizations who may be a certain age or maybe a younger age? It's also things that we think about from the culture. Language and accent. We know there's a huge range of people coming into this country now. And are we then taking into account that they may have different accents, but also as well understand that we have to also help those as well. Nationality, food and drink, I think is hugely important. Sexual orientation, gender identity, the region of the country, religion and spiritual practices, as we know. And a growing area which people are not actually aware of is now neurodiversity, because people are not realizing the huge element around neurodiversity and importance what it is. So as you can see here, culture and culture appropriate care, or culture-centered care, as I've coined it, is something I've written on. It's hugely important when we think about this. So do bear that in mind. So if we think about how culture is important, the lack of cultural competence creates a barrier to effective communication. So these are missed opportunities to provide appropriate interventions tailored to the patient's health needs, but also as well to our staff, our service users. If we do not connect from a cultural point of view, whether it's any of those areas I mentioned, the likelihood you're going to have a barrier. And if you have a barrier, that means things are missed. You don't get to know about someone, understand about their needs and how important it is. It's highly important to understand that culture is really embedded in your organizations. So you may ask the importance of this, of how important it works. Well, I always say, if you think about inclusion, think of the opposite end of inclusion. So if anyone has been excluded ever at all, it's not a nice feeling. I know when I was in the playground and wanting to be in the school team and I wasn't chosen, I really felt left out. I'm sure many of you have got an experience of not being included, how bad it feels. To just imagine any of your staff or anyone working or your service users or clients. But then we look at separation, which no one wants as well, because if things are separated, it still doesn't work. And you can see it is another area to think about. Then I think of integration, which is one of the things I see in a lot of organizations now. And I'll give you an example. An organization I went to and worked with, they had a great building and you went in there, as you can see here, they've got all in the same building. They were good care business. But however, when you went in the business, you went in here, this was the first floor and this was the second floor. And believe it or not, the first floor never spoke to the second floor and the second floor never spoke to the first floor. So there was lack of integration. So they still didn't share. So as far as they were concerned, they still weren't inclusive. What we want in organizations, where you've got different sites, we want to be included, because the more information that we share, the less we fear. So we get to know, we understand, we share information. It's not just for the service user or the end user we care for, but also our staff. And you'll see why it's hugely important when we go there and think about it going on beyond that. I usually do a lot of training in this area. And one of the areas is they look around food discussions and book people in groups. Because of lack of time, we won't have that. But it's about really how we impart and think about how food can be really important for us. And it's about how that can be shared. I'm sure Peter will probably remind you, or if anyone didn't, as part of a project we did with Keeping Well South East London, we did a jollof rice cooking competition, actually, where we brought food as the binder to bringing people together. And everyone knows jollof rice is a fiercely competitive dish in West Africa, where different countries claim to be the ones who are the winners or the best providers of jollof rice. And it was really important when we did this, because after COVID, the notion of bringing people together was also an important factor. The woman who won, and it came down to two people, and there were two countries. It was between Ghana and Nigeria. Yes, and everyone knows this is fiercely competitive, and it's known as a Jollof Derby. But the person who won, it was a woman who won. She won because it wasn't just about the great taste of her food and how wonderful it was. Actually, what happened during COVID was on a Friday, she would bring her actual jollof rice into the hospital where she worked in the A&E department. And what you found on a Friday, which was notorious Friday afternoons, where a lot of consultants or doctors, if there's any in the room, I apologize, probably would take the afternoon off or not come in, or maybe those who were fortunate enough were playing golf. But she was soon playing, actually bringing her food in. And then the word got around, and all the doctors would be coming in, they'll bring Tupperware. And guess what? Soon afterwards, everyone said, if you're going to be sick on any day of the week, be sick on Friday, because everyone's in there and you get all the doctors and consultants and get the best care possible. And that actually was the thing going forward. And this was why the woman won. It wasn't just about the taste of her food. It was how inclusive her food was and how it can make a difference, and how you can do that within your organization as well, of making people feel that they belong and welcome. And for those who want to know and probably itching to find out, the winners were Nigeria because of that itself. So for those in the room, they can have a little cheer for themselves. But you can understand the importance of food and how it breaks down for us as well. So we think about the inclusion. We thought about all the different cultures, and as you can see, the wonderful spices that come from around the globe, really are helpful in regards to that. But we think about the demographics and the makeup of the sector. And as Peter said about the Skills for Care's sort of care of state of care report, it shows around 23% on, this is nationally, of the workforce are ethnically diverse. About 82.3% are female, and around the average age is around 45. And about 1.7 are registered disabled. I think about 0.9 are under the age of 25. And you can see here all what it covers in this area and how important it is. So you can see that. But also bear in mind that stats as well, and the demographics, the makeup of the sector, are different across different parts of the country as well. And also you can see, and you think about how England, sort of like the makeup of England is, and you can see at the bottom here of the ethnicity sort of breakdown across and through the census, showing the members that were Black, Asian, white, other, mixed, and other. It said that the most ethnically diverse region was London, which we are mainly based in, but we cover nationally. 46.2% of the residents identify with Asian, Black, mixed, or other ethnic groups, and a further 17% with white ethnic minorities. So you can actually see the trend of what's going on in our sector. It's how diverse it is, but just also as well nationally across especially in London. And London's population also identified with a religion other than Christian, up from 22%. The next most common religion and groups were Muslim, and bearing in mind, as a slang, it's Ramadan, people are fasting. If 15% of actually the community are made up from Islamic culture, from an Islamic background, you can see, are we actually prioritizing, actually looking out for supporting the staff? Are we actually thinking about Friday afternoons? Are they able to go to the mosque for prayer time? It's not just the usual regards of Sunday where people go to church. It's bigger than that. So bear that in mind. And as you can see, specifically things like London, and people wouldn't understand that 47% of the actual London workforce are made up of a Black, African, Caribbean, Black, British, as you can see, and only 29% are white. So you can see how it varies across the country. And then, as you know, there's more males in London, 21%. So any males in the room, please raise your hand and be happy. But you can see how the makeup is and how the demographics are forever increasing and changing. And I'm sure you know, there was estimated of about 70,000 people coming into the country from overseas, from the international workforce. So you've got an influx, even more of a different demographic change. So why it's important to be more culturally aware of your staff and actually the people working in the organization. And then you can imagine as well, there's also things like health, ethnic health inequalities in the UK. And it shows where things such as Black women are 4 times more likely to die in pregnancy. these are just some stats here I'm just sharing with you of why inclusion and being really culturally aware are hugely important. It shows here that 2 to 4% of South Asians and Black people are more likely to develop type 2 diabetes than white people. So when we are actually understanding the makeup and going forward with the care that we're providing, how does it look like? So bear in mind, so you understand why the importance of really understanding and being really inclusive of your practice is a really way to go forward. And you may ask why is it important? Well, legally, you can see now where it steps, where there's elements around where we stand. And you think here, the Equality Act 2010, you've got Human Rights 19, Act and then you've got Mental Capacity Act, Care Act 2014, Health and Social Care Act. These are all hugely important. But where anything starts and stops is the Equality Act 2010, which really lays the groundwork for what we're doing here. If anyone is not aware, since 2010, the Equality Act has provided the legal framework for protecting the individual from unfair treatment. Also, it's important to be aware that as an employer, it could be found vicariously liable for actions of your employees which breach the Equality Act, whether they're aware of it or not. The employer must ensure that the process and the policies within the company comply with the Equality Act. Failure to do so can raise a claim of unlawful discrimination, which could result in then organization being summoned. And to fully protect your employees and business from discrimination is critical to understand the Equality Act, as well as ensuring that their workplace culture is actively inclusive. You can see here what the law is saying. So now it wasn't just CQC on its own, and now it's the law telling you. And you can see here the Equality Act is it's against law to discriminate against because of at least one of these protected characteristics. I'm not going to go into it now. I'm sure you're all aware about the protected characteristics, which protects not just your staff, but your service users, everyone of your organization. And remember, the Equality Act doesn't just apply for a small individual, it also applies to governments and local authorities. And there have been various cases that have stood up around there. As you can see here, a care home failed to meet a woman's cultural needs. Sawyerr Council has apologized after a woman suffered significant hair, diet, and skin problems when a nursing home local authority placed her in failed to meet her cultural needs. Despite this, the family reported further concerns to the council, including that the woman's hair was damaged because of the neglect. The home's own care notes indicated that the hair oil and moisture were only applied on 29 days during the woman's 20-month stay, and just 4% of the time she was there. The Ombudsman report found the care plan developed for the woman by the council failed to take into account of her individual rights in line with her requirements of the Equalities Act. Also found the council did not do enough to establish the woman's cultural needs when formalizing her care plan. The report had said that the home had done so. It's likely the facility would not have accepted her place. So you can see that not only were the care home taken to court, also the council as well. So it shows that if you get it wrong, there are measures that are going to take place. And if that doesn't take and affect you, there's a huge range now of unfair, but also discrimination cases taking place. And as you can see here, elements under here, things such as unfair dismissal, 184,000, race discrimination, £452,000, sex discrimination, disability discrimination, religion and belief discrimination. You can see this is a growing area. And just to bring this in context, the maximum award is now 474 for race discrimination case. It was half of that the year before. So you can see now that people are now becoming more savvy and they're going to take up these cases, not just families, but also workers as well. So it's a growing space to really be important to understand. I know we haven't got much time, so I will try and run through this as much as I can. Also, as well, we bear in mind our human rights as well, the Mental Capacity Act, and also as we're bearing in mind how all of this is important. But also remember to balance in your rights and risks. Just because you are actually trying to comply with the law doesn't mean that you shouldn't be able to think about individuals and actually be giving them the support they need. So for example, if someone who's from a different cultural background Don't just stop giving them food because they're coming to your service. Actually think how we can give them a type of seasoning or flavor in their food. Or if we're going to give people their cultural needs, maybe, for example, ask maybe someone from the church to come to your place of work, or actually someone from the mosque. So all these things mean that you can balance up the rights. People shouldn't be really losing their rights and their rights of life and all the things they're entitled to, because if you're doing that, then that means you're subjecting people not to feel that they belong in your organization and service. So really important, it's really important to put that forward as well. But also as well, remember in mind that we all have values and beliefs, and if everyone's values and beliefs influence the decisions they make, they become especially important for anyone, especially for those who lack capacity. And it's hugely important going forward. Think about their cultural background, religious beliefs, political convictions. So I'm also been touching upon an area which is also developing as well, because we look about cultural needs, we talk about protected characteristics. I always speak to individuals now, especially when it comes to those of staff coming into the country. Do they understand what LGBTQIA plus means now? And the reason why I say that, and it's hugely important, is because understanding that is important. And for those, there is a huge range of elderly people who, for example, who are not feeling included and feeling that things are missed, especially from staff. And there was a stat that said that 45% of LGBTQIA plus individuals using social care said they had experienced prejudice. So if that was any other area like race, sex, or anything like that, religion, this wouldn't be allowed. So why are we not completing, or why are we falling foul on not being able to match these? A lot of it is around awareness, not even understanding what it means. As I said, I'm not going to challenge anyone now, but challenge yourselves. Do you actually know what the full meaning of every single word is? And it's the Alphabet Brigade, but just try and get yourself knowledgeable, but not just yourself, but your staff. And remember, homosexuality was illegal till 1967. So what you're finding is that a lot of people around that age group are now maybe people that you may be caring for. And if they still are fearful that people don't accept them for who they are, it can be very distressing. And so really look beyond that as well. So remember as well, your language and terminology is hugely important in going forward. Terminology around race, ethnicity, and sexuality evolves continuously. And it's important that you learn about preferred terminology used in your organization and with the individual support. It's also important to remain actively conscious of changes. The best thing is, I say for everyone, if you're not sure, always ask a person in terms of what they prefer. And this could be the person you're caring for or your colleague that you work with. Terminology is hugely important. And for anyone who's not sure, pronouns, going back to it, and I'm sure everyone is aware, if we're referring to he, him, it's referring to someone who identifies as a male. If you remember to she or her, someone who identifies as a female. And for those who do not identify as either male or female, they may refer to themselves or they or them. Bear this in mind when you see these pronouns, it gives you an indication. And also as well, just because you use these pronouns does not mean that you have to be gay or lesbian. It just indicates of what you identify with, male, female, or if you want to be included as they or them. And now use the terms such as non-binary as well. I would say take time to upskill yourself in knowledge and get knowledge. There's lots of information from Skills for Care as well, and so bear that in mind. Before you're leaving here, we understand that discrimination is real and that's going to happen with your organizations, and people are going to say things. I know various staff have said those from a certain generation may still use slurs and terms which are not helpful. So actually learning and just having things to say, things like, I'm sorry, you can't say that here. I don't realize that you think that way. That's not okay with me. I find that offensive. Hold on, I need to process what you said. All these things are really important, really for your staff to really feel that they don't feel like they're alienated. There's a raft of, as I said, tribunal cases, but the mental health and well-being of staff is hugely important. It leaves trauma, and also no one wants to be known as someone who runs a discriminative practice, because if you're racist, if you're sexist, if you're someone who's actually discriminates against with disability, it's not what we do here in care. So actually your staff really can empower them with actually things to say, but yourself as well, especially if someone working in your organization. It's not something that we do, and it should be really scrapped and really removed immediately. But then finalizing everything, because if this doesn't stand anywhere, it has to stand somewhere. CQC, of their new framework, have really looked into the importance of inclusion and really looked at things like effective. For example, we work effectively across teams and services, support people. We make sure they only need to tell their story once by sharing their assessment of needs when they move between different services. So are we sharing the stories? Are we being inclusive? How staff teams and work together? So that's really important. Then when we think about caring, as you can see here, treating people as individuals, we treat people as individuals and make sure their care, support, and treatment meets the needs and preferences. We take account of their strengths, abilities, aspirations, culture, and unique backgrounds and protected characteristics. People's personal, cultural, social, and religious needs are understood and met. We talk about the I statements. It really talks about how we can keep in touch and meet up with people who are important to me, including family, friends, and people who share my interests, identity, and culture. Personal, cultural, social, and religious needs, are they being met? CQC are looking at this. So in the I statement, showcase this, so it's hugely important. And then if you can look at how effective you are with teams and how caring we are, remember it's also important what CQC are looking at. It says staff have easy access to personalized support that recognizes the diversity of the workforce with proactive and reactive measures. They're also telling you, so all of this is really a soundbite and showcasing what you need to do. We want to practice equity, not just equality, so everyone is treated fairly, not just given the same, but make adjustments so it works for you. I think it's hugely important. I would leave you by saying that some suggestions for improving culture competency: hire diverse staff that's representative of the cultural diversity of the patient population, ethnic matching, create standards of practice, offer patients intervention, inclusive practices. These are all areas which are hugely important. Think about how inclusion can look now. This is just to say that it's not just about someone in a wheelchair, it's also we're inclusive for everyone. So that's one of the things I would leave you with. And there are many benefits of working in a diverse workplace, and problem solving, less turnover, increased profits, I believe, more innovation, creative ideas, reputation. All these things play a big part of what we're trying to do. So before I leave you, I'd like to thank you very much for that quick, very snapshot area of me telling you about EDI and not the training I do in this space. So if you're leaving here today, you would have learned that I've learned that people, and this is what Maya Angelou said, an American lady who really spoke a lot around diversity and inclusion. I learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. So that's what I would leave you with, everyone. And EDI and a lot of training I'm doing, personally, do come and let me know of why it's important and why this area is not just passionate for me, but how it affects us legally, helps retain our staff. CQC are looking at that. So many more things are important. So thank you very much for being able to be on that Whistle Stops tour around EDI and inclusion. And if anyone wants to be in touch, please do let me know and find out any more of that. I will keep you posted. Thank you very much.
Thank you.
Brilliant. Thanks, Dudley.
Okay, so I know we're sort of short on time. So just on the back end of really my EDI masterclass, everyone, we're going to bring in an organization called PJ's Community Care, who actually been showcasing a lot around the international workforce and the pastoral care element. It's important because with this area around pastoral care, people have forgot a lot about when people coming into the country. We're thinking about these are human beings who have maybe left their country of origin. They're in a new working place. Are we checking up on them? How are we really incorporating them? I'm not going to say this, but CQC have spoken to us. They are at our meeting. What they're saying, and I don't like to use the term modern day slavery just loosely, but what they're finding is a lot of people have come here and they feel that they're adapting to cultures, but they're not given the tools to do that. They're not being supported. People are given just 2 weeks to learn everything about social care that they've never known about, and as well as culture as well. These things are really things that we should try and avoid, but really think about what we're trying to do. I'm not sure if I think Laura is here from PJ.
I'm here.
Right, no problem. It's possible. I know we haven't got much time, but if you can have about maybe 10 minutes or so of really showcasing just some of the things you're doing and the importance of it as well.
That's fine. Am I able to share my screen?
Hopefully.
If you see the bottom there, hopefully you should be able to share screen. Have you got it there at the bottom of your screen?
Yes.
And it should come up, and hopefully one of the things of your slides, if it's open.
Brilliant.
Is that in full screen? Can everyone see?
It is.
Okay,
indeed.
great. So good morning, everybody. I hope you are all well. I know it's early. I hope you've all had your tea, your coffees, your breakfast. I won't take up too much of your time. So my name is Laura. I'm from PJ's Community Services. And at the moment, we are working with the South London Partnership to tackle workforce challenges with international recruitment. For those that attended Dudley's event on Monday, hello again. If you have registered your interest already and you have not heard from me yet, you will hear from me today. So I'm just going to briefly go over the support that we are providing to those in Southwest London. So as you can see on the screen, it is organisational and pastoral support. This is for both you and your internal staff as well as your field staff. So from around the end of 2023, we were commissioned by the South London Partnership to provide full end-to-end international recruitment for yourselves. That would be everything from helping providers get their licenses to sponsor, sourcing applicants, all the way to temporary accommodation, mandatory training and pastoral support. But we did come through with some challenges, whether that was with the obtaining a license or just some engagement. But from that, and from speaking with providers, what we did find was that there is a lot of fear and a lot of anxiety that does come with international recruitment. That may be the process, it may be the admin, it could be Home Office themselves. And two, we also found that there's also a lack of pastoral support for the staff. That may be the actual well-being for the staff. That could be both the staff and providers not even knowing the rights and the legalities involved. So that's what I'm speaking about today, how we can provide support for those that already hold licenses. And please note, we are still providing the full end-to-end recruitment, but we are focusing on how we can support you that already have the licenses. So this support is for mainly the 6 boroughs in Southwest London, which is Merton, Kingston, Richmond, Sutton, Wandsworth, and Richmond and Kingston, Wandsworth, Sutton, and Croydon. But if you do fit outside of that criteria, still pay attention and still register your interest and let us know what support you think is required for yourselves in the future, and we may be able to signpost you as well. So just an overview of the session, I'll just give a brief introduction to us, give you a background on the support and why we are providing the support, and finally the details of what we are offering. So my name is Laura Etaly. I'm the project coordinator and the main point of contact. So if you have any questions or would like to discuss the offer, you can contact me, you can email me, you can call the office, and I will be there to help you. Claudine Reed is our project manager, and Caramel is the project coordinator for the Pastoral Care we're offering in North London. So if you are from North London, we can also offer pastoral support. Okay, so just a bit about PJs. We are a social enterprise based in Croydon, and our main focus is on community transformation. And for 30 years, we've been using the vehicles of care to achieve this. So just like many of you here, we are a care agency. We provide both carers and support workers to vulnerable adults and young people. We provide business support and consultancy to social enterprises. And we also coordinate community projects. So With the 30 years experience, that's 30 years of care, 30 years of recruitment, 30 years of business support and inspections. And that is what equips us to be able to support you. So like I said at the beginning, we have been commissioned by South London Partnership to provide free support. I repeat, the support is fully, completely free, and to those 6 boroughs in South West London, so that you can better support your overseas workers. So before I get into the details, I just wanted to go through some media coverage. So you can see the headlines here. Cambridgeshire care workers struggling after agency closure. And there can be many reasons for agency closure or for why agencies can no longer work on their packages, but I'd like to focus on licenses being revoked. So on Monday, a young lady from CQC spoke about the consequences of using your licenses as a provider and for your staff. Providers not being able to continue packages, your international recruits losing their right to work. Now, if you have a sponsorship license, what can you do to ensure that it won't be revoked? Care homes, fears over overseas workers, family bans. So not only are licenses being revoked, policies are being implemented that does make it harder to recruit, and the amount of people interested in working in the UK may be plummeting because families can no longer come along. And just like the next headline says, foreigners shoulder health and social work in the UK, but immigration crackdown can deter them. Lately, Home Office have really been cracking down on providers with sponsorship licenses. A lot of providers have had their audits already. Some of you may had it already, or you may have a letter notifying you of one. There are many reasons for an inspection that can trigger an inspection. You may have a lot of international recruits. A sponsorship application may have been a sponsorship application, sorry about that, may have been rejected. But what can we do to make sure that you are compliant and fully prepared for an inspection? I quickly want to touch on one that isn't on the screen at the moment, and that's about, Dudley spoke on it again, and that's visa fraud. It's an extremely big and a very common issue nationally, even internationally. And the impact that it does have on the recruits is insane. We've had people come into the office and they'll sit and they'll tell me their stories. Some people don't know how they're going to live. Their living conditions are poor. Some are losing their right to work because licenses have been revoked, but then they can't even afford to go back home. So the impact is tremendous. And it's not like they're entitled to any sort of benefits or mental health support. Even for UK citizens over the age of 24, the support isn't really there enough. So this is also what we're trying to support with. Even though it is limited, there's only so much we can do. What can we do to prevent this? Now, this isn't only just for staff that are going through a ridiculously hard time. We want to ensure that your staff are equipped to work in such a volatile industry. Healthcare isn't easy. There's a lot that they will see, a lot they will hear, alongside being brand new to the country, and they may not have the support system outside of themselves. And providers can also only do so much. Providers you're busy. There's safeguarding alert here, invoices here. This client won't let staff in their house, file checks. There's so much going on internally. So what can we do to ensure that the well-being of your staff is in a good state? What can we do to make your lives easier? So just like enhanced organizational and workforce development, supporting both providers and internal recruits. So just like Peter said at the beginning, there are the business aspects of care tends to make an issue. So we are providing support to prevent the issues from occurring internally. Post-arrival support for recruits, including temporary accommodation up to 2 weeks, mandatory training, delivery of pastoral support to help your recruits settle into work and life. So we're providing just the arrival support for your international recruits. It doesn't just have to be those that have just arrived in the country. If you have international recruits in your organization, you are also eligible for the support. So the QR code, if you're already interested, I will go through more detail, but if you're already interested, the QR code is there. You can take a screenshot of it or a picture of it, and it will come up later again. So just in case you miss it, it will be there again for you to take a screenshot. So these 5 things is what we believe providers at this moment of time need to be able to remain compliant and rectify any problems that may have occurred already. So in-depth audit and compliance checks with providers with a certificate of sponsorships, mock inspections in the framework, in line of CQC guidance, mock inspections for UKVI compliancy, enhanced workforce development and action planning, enhanced organizational and support planning for providers challenged with meeting local demands, and collaborative conversations as well. So we're providing support in these areas by, we've created a digestible set of workshops. So we're doing this because there's hundreds of pages of policies, responsibilities, legalities, but the question is, are they being read? It's a volatile industry. There's changes here, changes there, new requirement, there's a new date for this new policy, it gets to the date, there's a delay, there's a lot. So just to make sure everything is digestible, making it quick, making it interactive, we've created these workshops. Just take it as training for your internal staff. So there are 6 workshops that we are holding, and they touch on 5 main topics. And then at the end of the 6 workshops, you are also entitled to a free mock inspection. So a UKVI mock inspection. So it will be a Home Office one, not a CQC one. And this is conducted by Neil Wilson. He's an international recruitment expert. He's done dozens, maybe hundreds of mock inspections already for agencies and care homes. So we will touch on the roles and responsibilities, making sure that you are compliant, making sure that you are given the correct pastoral support, or we can support you with that, work solutions, and mock audit inspections is the last one. So this set of training is really good for the authorizing officer for the UKVI SMS. But you can also take this if you are a service manager. It would be good for recruitment officers, for HR as well. And the aim is just to make sure that you are prepared for the inspections, that you do remain compliant. If there's any issues, you're able to spot them and fix those. And to help sure that you are aware of everything that comes with being a license holder. And pastoral support, which is the main big part of what we are doing. So the first aspect, which is not on the screen, is the buddy system that we've created. So this buddy system is so that we can accompany your new recruit when they come to the country and make sure that they have everything that they need initially when they come. So have they had their bank account set up? Have they signed up for their GP? We will show them around the local area, make sure they know where everything is, making sure they know where to get food from their home country, everything like that, so that they can feel comfortable, as well as showing them anything that may be unfamiliar. For example, someone that we've worked with, they weren't sure how to work the Pelican crossings, small things like that. We take care of and make sure that they're comfortable when they arrive. We also make sure that they know where their places of worship are. Yeah, all those kind of activities. So we also provide cultural intelligence training. So when an international recruit arrives, their experience is very limited. It's limited to where they've worked previously before, but the healthcare system in country A will be very different to the healthcare system here. What's legal over there may be a safeguarding concern here, and we just need to be able to prevent those issues from occurring. So those are held by Dr. Joan Myers, OBE. So she is an award-winning strategic nurse leader. She has almost 40 years experience in healthcare. And she delivers cultural intelligence training to nurses that have been recruited internationally for the NHS. So the same quality of training that she gives to NHS nurses is adapted and made more fit for purpose for carers and support workers, but it is the same quality training that she provides to those nurses that your staff will be receiving. And the purpose of this is to foster a better understanding of diverse patients' backgrounds and their staff backgrounds as well. It will improve client satisfaction. They learn valuable skills, being able to navigate in diverse working environments, and it creates a more inclusive and supportive workplace. And it also just increases or enhances the communication and trust between stakeholders as well. I would like to stress that cultural competent care really does improve the quality of care that is performed. By recognizing and respecting any sort of cultural nuances, you can tailor care plans, you can address unique health perspectives and any other challenges that may occur. We also provide mandatory training for your new staff if they have not had it already. And we are also providing a booklet for your staff as well, like a welcome pack when they come, or it would be good if they're already here as well. There may be things that they don't know. So how do they set up bank accounts? I think we had one staff member that had been working for months and they didn't even have their own bank account. They were sending money to a sibling's bank account and we needed to show them exactly how to do it. Things like, are they being taxed correctly? How does the tax system here work? How can I personally develop during my time here? What classes are available for offer? What can they do in their spare time? And also, most importantly, what are their rights? How can they recognize what modern slavery looks like? Do they know that they have been recruited ethically? Things like that is also in the booklet to make sure that they remain safe and do not experience any sort of exploitation. Okay, so there's three main bodies that govern us: fear them, love them, anything. So what we're offering just ensures that you remain compliant, but it also makes sure that they love what you do. You will impress them by taking what we're offering. They will see the extra things that you're doing to ensure that your internal systems are working and making sure your staff are well looked after. I remember after a inspection, I asked, what's the difference between a good and outstanding? If everything is right on paper, shouldn't that be an outstanding? But I may be wrong, but what they said to me was that the difference is the extra work that you put in. Can you demonstrate administrative excellence? How well are you managing your relationships with your clients and with your staff? And I believe what we're offering allows you to have the space so that you can do these things. Okay, so thank you, everybody. Thank you for your time. I hope I didn't take up too much time. Please do take a screenshot of the QR code. My email address is there if you have any questions. We are looking to start workshops next week. So I will be in contact either today or over the next couple of days. So yeah, do look out for an email from me. And yeah, if you have any questions, just let me know and I'll be in contact with you.
Thank you so much, Laura.
Thank you, Laura.
Thank you, Laura. Really. Also, just to let you know that this isn't just taking place. PJs have been doing work in North London as well, not just in South London. So if anyone's on a call from other parts of around London as well, you can actually do that. So be in touch. We will make sure that everything is done accordingly as well. So thank you much for that information. It's really helpful because this is funded support as well. So you're actually not having to pay for it at all as well. So thank you very much for that. Peter, I think we are about to wrap up and there's a few bits of housekeeping just to share. I'm just going to share my screen. Oops. If you bear with me.
Yeah. I've got 2 or 3 points. And Laura, thank you very much. Would you please send your slides over to me and I'll put them on the website.
I'll send those now.
Great stuff.
Go on, Peter.
There are 3 things to mention. If you are based in or working in the boroughs of South East London, there is a separate employment recruitment hub, and we are working with them. We have an event on the 13th, sorry, not the 13th.
18th.
We have the 18th. It's the 13th today, and there's a QR code there. I've put the Zoom link in the chat, so please do attend. It's free, and there's quite a lot of support, which is again free, to help you get recruits in South East London or working in South East London. I've had people query this morning what's happening with the next international recruitment event on the 21st, where we are having the Home Office come to that virtual meeting. Now, the reason that I haven't put an invitation up is because at the moment we don't know the time of the meeting, because the Home Office haven't confirmed what time they will be available. As soon as we have that, we will pass it on. And finally, if you're struggling with things like legal aspects, health and safety, or HR problems, then do contact Citation. Obviously, it's a chargeable service, but they will give you half an hour on the phone for free. So you may well get a key to your problems. The next Registered Managers meeting will actually be on April the 24th at the Care Show at Excel.
The National Care Show, Peter. Did it right.
And Dudley has organised that. We've got a panel. We have got providers on that panel. We have got Commissioner on that panel, and a couple of other very useful people. So there's a lot to learn. You will get details through, and you may well already have had an invite directly from the Care Show. So we look forward to seeing you there. And then we'll have another virtual event in May. And say the recording of this and the slides will be on the website as soon as we can. Thank you very much for coming. Have a good day, and over to you, Dudley.
Yeah, thank you very much, everyone, for turning up. There's a lot of ongoing on, so it doesn't just mean you wait to the next meeting before you see us again. We're probably going to be, we're available, as we say, via WhatsApp, emails. You can contact us. Peter meets with CQC. I'm speaking nationally, and we're trying to get as much information to you as quick as possible. It's the end of the financial year, so there's a lot is going to change in probably the next month or so. So bear in mind, not just international recruitment, CQC registrations, Home Office, and so many things going on in this space. So watch this space. But please do catch us at the National Care Show at Excel. We will have a panel on the 24th of April. I believe the time is between 3 to 4. And it's going to be a full house. So and get to see us in with everyone else down at the Care Show as well. And we'll give you some more information on that as well. Thanks again, everyone.
And just don't forget to get me the information about fees, rates, fee and price increases for 24-25, please. That's very useful, and it'll be anonymous. Great stuff.
Everyone, take care and have a good day and rest of the week.
Thanks all.
Thank you.
Thank you.
All the best. Bye now.
Thank you very much.
Thank you. Bye.
Thank you.
Thank you, everyone. Bye.
Bye-bye. Bye.
Thank you.